Today, I'll just introduce myself in brief. I'm Dr. Pradeep Mahajan. By training, I'm a neurosurgeon, also working on research in regenerative medicine, smart technologies using artificial intelligence, tissue-based regenerative procedures, organ developments, anti-aging, autoimmune diseases, developmental disorders, joint disorders, neurological, infertility. And every week, we'll try to bring you the wonderful basket of various applications and give you solutions to unmet needs or challenges in various conditions and various specialties. Today, before I go ahead, I would like to just give a brief outline to you. We are not going to talk only about the stem cells or growth factors, but their application into rejuvenation. What are the certain facts? What are the fictions? What are unknown and what is the future, particularly related to the skin conditions? Overall, to introduce myself, currently, my assignment is adjunct professor, assistant professor at Indiana University in USA. I'm also a diplomat of American Board of Regenerative Medicine and a faculty and director to run a fellowship programs with the government of Maharashtra, that is Maharashtra University of Health Sciences, 2 years fellowship program. And I head and lead the research team at STEMRx to bring new technologies and translate them into clinical site. This is my appointment in Indiana University. This is my diplomat program. Before I go ahead, I'd like to just give a brief idea to you to understand what I'm talking, why this science of regenerative medicine is helpful in dermatology to look into all those chronic unmet needs. Because in skin, we look into two types of conditions, acute and chronic conditions. And chronic conditions go for years together gift. As well in the skin, we look into two parts. One, parts of the skin, which is skin is the largest part of the organ, largest organ of the body, having its own components, skin appendages, we call them, and also supported for this skin appendages function. We have a supporting cell systems. These are extracellular matrix, vascular structures, neurological conditions, all those are attached in the skin. And they support these cell components are appended to the skin to keep it two functions most important. One is excretory thermoregulatory function, that is protection of the body. And second, it has a role to play the protection of the skin from the external environment. These are two things which we play here. In addition to that, what we look into, though cosmetic is not a normal function, cosmetic is an outlook of the body. How do we look? How do we see? How do we appear? It's an personality development part, aesthetic part, and also self-recognition part, which gives a confidence to you. So in this context, before we go ahead, the support of chronic disease, support of regenerative medicine, particularly in the chronic conditions related to diseases from hair, from epidermal cells, from melanocytes, from lymphatics, from vasculatures, from connective tissue, and sebum glands, sweat glands, which they have their specific role to play. But when the normal ecosystem of the skin is lost, that is what we call homeostasis is lost. For this function to maintain, these organs of the skin, parts of the skin, lead to disharmony in their function, which I call as a disease. That could be acute one because of the injuries or infection. That could be chronic because of the long-term of the diseases which convert into over a period of time into chronicity. And usually the chronic conditions of the skin are big challenges for all of you. And secondly, acute conditions are challenges for they should not heal with the scar formations or keloid formations or some kind of pigmentations, disfigurements. So we look into this part today. How do we deal with them? Before that, I would like to just brief you what are the stem cells in your body. Also, the parts which support the body like exosomes, growth factors, ECMs, how do we imply them into application, translate into repair system of the body, into therapeutic part. They play repairing of the body. The stem cells are undifferentiated cells of the body, giving rise to infinite number of cells, one, and secondly, different type of cells. These are the basic two conditions of the stem cells we read. What is a stem cell for you to make understand? Stem cell is a master cell of your body. If you see in the slide which I have shown in front of you, it will show you the first picture of single embryo. This single embryo comes from a sperm and ovum and makes this a single egg, carrying 50% information of DNA from the father, 50% information carrying from the mother ovum, sperm and ovum, and makes a new DNA sequence here. And this new DNA sequence carries the code information of your life. Who are you? What's your color? What's your process in the life to suffer from any diseases? What are the likely chances of you getting cancer? What are likely chances of you suffering from any major disease? The information in which cell the DNA is coded is called a master cell. And this master cell is the stem cell of your body. Now, once I tell you, this master cell is building your whole body. From this one cell, we make around 150 trillion cells of your body, 150 trillion cells of your body. These 150 trillion cells from hair to nail, which are the part and appendages of the skin, play a major role. And then the rest of the part of the body, they come from this single cell. Now, apart from those 150 trillion cells, it makes 220 organs of your body. Why I'm telling you this? Because it's very important to know why I say these kind of cell components, growth factors from the platelet, ECM, MSCs play a major role to treat any worst complicated skin disease, which I will do subsequently with example, which we do regularly. And we just want to translate this for everyone to take the benefit of at STEMRx. And also those who want to learn, they could participate in the teaching and training program, those doctors who want to at STEMRx. Now, these cells, single cell, you can see 150 trillion cells, 20 organs, 30,000 genes in the nucleus, 5,000 genes in the mitochondria, cytosol, cytoskeletal wall, and ECM. They make a simple functional unit. Now, this single cell makes 16 cells by meiotic division. And these 16 cells remain totipotent. Totipotent means they can create an entire human being along with the cord and placenta connecting to the mother uterus. Now, once they divide with the CXCL2 gene expression, upregulation, the inner cell mass, which I'm showing here, and outer cell mass, which I'm showing you there on 7th day of the embryo, it makes sense to understand the outer part which comes here is the extra embryonic tissue makes a cord and placenta, whereas this particular inner cell mass makes your embryonic tissue, and they call are pluripotent cells. They can make all the cells, but not whole body. That's called their pluripotent. Here they were totipotent. Here they are pluripotent. So these cells start differentiating into skin, hair, nail, liver, kidney, brain, and other parts of the body in the form of tissues. Till then, the process is called ontogenesis. Now, this ontogenesis process makes you very comfortable to understand that all the tissues in the body are coming from this single master cell, that is a stem cell, master cell, which comes as an inner cell mass. An inner cell mass makes all this skin and appendages, nail, brain, heart, everything. Today, I'm focusing on skin. That is the reason I'm talking repeatedly. First is the skin. When I talk on neurology, I go on the neurology. When I talk orthopedic, I go on the orthopedic. When I talk autoimmune, I go on autoimmune. When I talk on the lung, I go on the lung. When I talk on infertility, I go on infertility issues. Now here, these cells lose the pluripotency and they become adult stem cell. From here to adult stem cell here stage, till your birth and after are all adult stem cell. Though I have written embryo, the tissue is embryo, but the cells are adult cells. Here also, at the 6 weeks also, at this stage, up around 6 weeks, all the organs start developing and we call organogenesis. Now, if you see here, the size of your skin when you are born of 2.5 kg child, maybe in a 1 meter square meter, maybe. Right? But when you grow, it's less than that, probably few square meters, feet. But here it is more than 1.56 square meters, 1.5 to 2 square meters of the whole body skin, if you count. This shows the skin is developing from a small size to the major size. And for you to give a simple example, when you have an injury of the skin brushing when you're a child, you come to a physician like me, I'll put an ointment and tube, painkiller, antibiotic, and send you home. And after 7 days, 10 days, I'll open the dressing and see the injury is filled up, or skin has new skin has come, or scar has come. The two possible, skin or scar. In the childhood, small child up to 1 year, 2 year, 3 year, it will be always a skin regeneration, because the number of stem cells in the skin and the epidermal dermal layer are very large number, and their job is to increase the skin size. So those skin size increasing stem cells present in the dermal stem cells present in the skin, they help us to repair the skin by developing the skin layers. Whereas when you get an injury in an adult, when the skin expansion is over, skin growth is over, you get scar formation. These are the two differences. Younger, skin healing without scar or minimum scar. Older, skin healing with the major scar. That too, it may have sometime additional TGF beta of a proliferation, which will lead to scleroid formation or hypertrophic scar formation, or non-healing conditions which lead to a chronic scar formation. Now, having known this part of all these stages and skin role and the healing of the skin without your interference, you may not give any antibiotic. Skin heals with its own antibiotic. Patient has, well, I'll tell you what does the skin do, what the role of skin parts with the platelets, MSCs, they do with your skin, that I'll tell you in subsequent slides. They play a major role of healing without antibiotic application also, but we take it over precautionary, because these cells are antibacterial, antiviral, have got immune response, have got angiogenesis, have got anti-apoptic action, have got antifibrotic action, they have got healing properties, they have got new tissue differentiation properties. All these properties are present with the skin cell. That is the reason it heals automatically, whether you apply or don't apply. Means body heals. If the healing of the skin takes place by the skin cells, can we not use this repairing system of the body into therapeutic application? So I convert the healing process of the skin, which I'll show you subsequently, into application where I can heal the scarless and any kind of disease, like whether it's eczema, lipodermatoses, or you can have psoriasis, scleroderma, they can be healed with the stem cell technology here. Two types of stem cells, which I told you, embryonic, when we come at the level of morula, where we call embryonic stem cells, or blastocyst, totipotent cell, pluripotent cells, those are the embryonic stem cells. But after blastocyst, whatever comes with the ontogenesis, where the tissue are forming or organodeveloping, they are adult stem cells. Now, sources of adult stem cells when we grow are from the bone marrow, muscle, brain, skin, all have a sources, placental cord, baby teeth. And when we use our own cells, we call autologous, and when we call other cells, we call it an other source, we call them an allogenic source. Means if I use a placental cells or cord tissue cells, those are allogenic for me. If I use bone marrow cells for me, skin cells for me, adipose cells for me, those are autologous cells. This I cover up as an umbrella. The job of my stem cells or platelets is to regenerate, to restore, replace, and repair by using a complete plethora of products of the biological from our body. So if you see my tagline, always write, we carry our repairing tools in our body. And these tools are your tissue cells, cell surface markers, MSCs, beta cells, chondrocytes, epithelial cells, melanocytes, neural cells, PRP, scaffold, adipose tissue, VGF, all they put a big plethora of biological products from your own body, which will help you to regenerate, restore, replace, and repair whenever you are stuck up with the standard medical care. If you understand myself, I'm basically a surgeon. Last 10 years, I'm in research. And now my concepts of treatment to the standard medical care are much different, which I'll show you subsequently. This is the natural philosophy. Healing is the natural philosophy. Innate regeneration is our body's capacity. 1988, if you see, there was an huge fire in Yellowstone fires, and entire land was burned on US, completely gone. In 1998, subsequently 1 year after, little showers of rain, you could see some plants, some roots are erupting out, showing that though everything was destroyed on the earth of life from the plant side, again it can come up. And now today in 2023, the forest has come back completely. This shows in the capacity. I have shown animals, plants, and forests there for you for the reason to understand everything in the nature has a power of regeneration, whether it's a seed, with the plant, with the animal, with the human being, with the bacteria, microvirus, with the RNA, with the DNA, which is a living being, has a power of regeneration. This shows if the nature has a power of regeneration, then do you forget that your body is a part of the nature? So it has a power of regeneration as a common sense to understand. And this we can understand from this single slide, which shows you the innate regenerative capacity of healing power of your body is 15 million blood cells expire at a given time and replaced by the body that moment of every second. Means 15 million cells are dying, blood cells, and 15 million cells are replaced every moment. Every moment, I repeat, every moment. The body's perfection system of healing by regenerating the cells, you can understand from this. You are alive, your innate capacity is so strong, and we take a lot of antibiotics, a lot of antiviral, applying on the skin and rubbing and putting some kind of sclerosants and all those and create a scar when it can be healed by only your body products. Worst infections, worst lymphatic blockages, worst vascular disorders, worst autoimmune disorder related to the skin can be completely healed using the technology which I'm going to talk to you today. Even non-healing diabetic ulcers, gangrenes, everything. Now, the overall regenerative medicine picture is working for everything. Recently, I had a talk on CME on plastic surgery, then aesthetic work, cosmetology, hormones, particularly in the infertility, anti-aging, and specific for neurology I have not shown here, only bringing to the skin-related things I brought. All these are skin-related things. Today, I'm going to talk only on dermatology. I'm not going to talk on aesthetic, cosmetology, anti-aging, hormone replacement, and plastic surgery problems, because these are also part come to the skin-related. But today, I'm going to talk to you on only dermatology. Now, what is our toolbox? What is in our toolbox? In our toolbox, as I told you, it's a plethora of cells, plethora of cytokines, plethora of growth hormones, plethora of biological active factors, plethora of exosomes, plethora of, you can say, platelets and its products and growth factors. All are as a toolbox we are using, in fact, along with the cell. And that I'm going to talk at STEMRx as a translational method, clinical translation leading to cell therapies. And rest of the for artificial organ development, those are different work. But I'm going to work on biomaterial and tissue work and cells for your skin healing today. Now, when I seen you, I told you, entire plethora I shown you. Of that, most important molecule is mesenchymal stem cell. Mesenchymal stem cell, it is a misnomer to understand. In the body, they are the 24/7 drug stores producing 700 plus cytokines, chemokines, antimicrobial, immunomodulatory, angiogenic, anti-apoptic, reparative molecules. They produce everything what you want in the body in a given environment. They are present in your bone marrow, they are present in your skin, they are present in your lung, liver, every part of the body. And when they are present in the body, I call them pericytes. They are anchored around the capillaries. They are anchored around the capillaries. And they control the vascularity, particularly compression, relaxation, compression, relaxation. These are the pericytes which control in the skin also. Earlier we were taught in the medical school, this is controlled by circular muscles of the capillaries, anchored by autonomic system of our body, that is parasympathetic sympathetic system. But it is not true. Today, I can boldly say you, this parasympathetic sympathetic function is not done by circular muscles of the vessel to control the BP, but that is done by pericytes, which are the form of MSCs in the body. MSCs which play a present in every organ, including skin also, they are present in the capillaries around the capillaries and lymphocytes, anchoring around the capillaries to contract, relax. And also whenever there is energy, this molecule MSC is released in the response of infection, trauma, inflammation, immune-related problems, anything, your environmental problems, they release these kind of cytokines in the skin. You can imagine anti-scarring, angiogenic, mitotic, reparative microenvironment. These are pericytes I spoke to you. And on the front side of the body, where the front, when you hold the cell vertical, there are two parts, one front side and back side. Back side is a reparative part, tropic part. Front side is a protective part. This is a tropic part. Back side I'm showing again, which helps you to develop your skin scarless, produce antibiotics, produce angiogenesis, anti-scarring, a healthy microenvironment which requires for the scarless healing, or even to treat the autoimmune diseases or inflammatory conditions. Whereas front side, where the dendritic cells, T cells, Treg cells, or immunomodulatory molecules are released by same pericyte on the front side and the back side. So this is dealing with the infection, immunomodulation. So this side, which I'm showing you front side, will release immunomodulatory, antimicrobial, and also T cell, B cell exosomes. Whereas rear side, these are the molecules that are produced. So MSCs are 24/7 medical stores in the body and not the stem cells. Let's see the platelet. Now, dogma of the platelet till today, if I ask you, some of the doctors who are present with me, where the platelets are produced, you will say always they're in the bone marrow. Some of the time I'll take a CME or this one webinar on platelets and lung disorder. Now, for the reason this, I prepared this slide for you to know that they are 80% produced in the lungs, not in any part of the bone marrow. They also are present in the skin in a huge number. They are present in the form of thrombocytes, small discoid cells of the size of around 2 to 3 micrometers. And also their lifespan is 8 to 12 days. That's a very important part of it. They're colorless. They don't have nucleus. They have alpha granules and beta granules. We are going to look into alpha granules, which are 100 plus cytokines they are produced. Each cell, each platelet has got around 80 to 120, 150 granules of alpha producing various growth factors. That is VGF, EGF, PDGF, GF, IGF, matrix, metalloproteinase, and sphingosine, platelet, microplatelets, VGF, all which we require, collagen transfer growth factors, all those are produced here in the cells. As I said they are antimicrobial, antiviral, and also antibacterial healing properties. Most important, the growth factors, which I showed you the properties which I will take, these are the factors which come as epidermal, insulin, vascular, connective, platelet-rich plasma has got this, which play healing of the wound, immunomodulation, or healing of the scars. Why we don't want to see PRP as a new way of dermatological conditions and dermal conditions and hair? We need to rethink. Do we want to use our own body, which is autologous part of the body, prepared from the platelets and MSCs and ECMs, extracellular matrix of our own, to see that there is no side effect, but going in a natural repairing system as a natural way, converting to therapeutic applications, so that the immune-related problems, antimicrobial problems, or antiviral problems, or chronicity of the wound, which has come play because of the chronicity, leading to non-healing properties, lead to vascularity, lymphatic accumulation, inflammatory molecules, we can deal much more better by the natural way of our own body products like platelets, which I showed you why, their properties, qualities, MSCs, which I showed you why, their qualities. We can use them as a product to healing, promoting properties and antimicrobial properties. of PRP synergetically act to prevent infection also. What is the role of them in the skin? These platelets or MSCs, their role, growth factor is there. The word I have used, a platelet lysate or lyophilized powder from the growth factors, which we use at our center and work on beautiful outcomes of the skin, almost every disease. It works through an pathway of NF-kB signaling pathway. Okay, this pathway is a total working on the skin, total healing properties, which has been demonstrated in our lab in vitro also, in vivo also in the clinical studies. So let's see how we can determine, use this pathway of our body, which normally functions, I'm showing you. Use this only as a therapy. Use this only application in the treatment of chronicity of the skin, acute condition of the skin, hair problem, as well as nail problems. Let us work on the dermatological part. This is a paper which I published, which I show you today, or 2022. This I'm showing you for the reason to build up to your knowledge and confidence that these are recent works which I'm going to talk to you today, and how I can change your life with the applications to see how we can do much better for your skin. What we do at our lab is we lyophilize the platelet. The purpose of is to extend the biological life, stability, half shelf life of the product, of the platelet. Normally, as I showed you, life of the platelet is 8 to 10 days. We cannot keep more than that. But if you want to use as a molecule of your platelets for your treatment, then you cannot work on lifespan of 8 to 10 days, because it may take 15 days, it may take 20 days for you. So for that reason, we work to improve the lifespan, half shelf life by stability of the cell by lyophilizing. Lyophilizing means converting platelet powder into a amorphous powder, which has got a 1 year, 2 year lifespan without losing its potency. Half shelf life will be increased as much as you want here. Also, preserve the biological activity of the product without having deep refrigeration. You can keep maybe at 2 degrees or 4 degrees. Also, thermoliability means material is not affected by the temperature, environmental content of the water content, the air, that is humidity, or any other radiation works, or light works on that. Reduce the product weight so that this can be transported from one place to other without any cold chain maintenance, and half-life is maintained, so as you can use this platelet alpha granule factor from the platelet for 2 years, 3 years, 10 years at a room temperature and store in the door freeze of the freeze. This, what I'm going to talk today, is not today's story. It is a 50-year story where people have developed this technology from 1959. The trials were done at various levels for bleeding and other conditions, but today I'm going to talk of application in the USA. What we do at platelet at our center is we remove RBC, platelet content very nil, zero RBC and WBC, so that we are not having any kind of inflammatory problems here. Now, growth factor content are elicited by the ELISA test, and normal levels which are present to 100, 150, we concentrate these factors like VGF, vascular endothelial growth factor, PDGF, and FGF at least 5-fold. So from a physiological response to a pharmacological response. So this converts the platelets into a pharmacological molecule to use for healing of the skin problems. This is what we work on at StemRx. Our analysis shows these are lyophilized platelet powder having these properties, contents, and compositions. These we prepare from the platelets, and this is our trial which we conducted at StemRx, which has shown complete safety in the skin as well as lungs, an animal study, which is published by ourselves. And we were the sponsors for this study, and we have done this study at different levels. Now, this study, different places taking in Pittsburgh, in out of the country, at Rashima Etology, Cairo University, they're also doing these studies. This is a license for us to use this protocol for treating skin problems as well as lung problems. Adipose stem cells, another type of stem cells, which are in the SVF, we call them. Vascular, SVF, somatic vascular factor, stromal vascular factor. These stromal vascular factor, again, prepared from your fat tissue of your body. We aspirate do a mini liposuction, take the fat out. Then in our lab, we prepare SVF of it, which has got a complete cell components from a pericyte to complete endothelial cells, VACLL cells, MSCs, which will be again a part of your platelets will be there. And they become a potential therapeutic tool for anti-inflammatory and immunosuppressive properties. Also reduce the excessive scarring in your skin. So we use these molecules for reducing skin problems. The adult cell can successfully isolate from the patients of all age and cryopreserved. This is one of the facts which we are showing you that we have a cryo system of our lab. Once we take your cell component from your fat, this I can keep it for your 20 or 40 or 50 years stored in our blood, in our cryo bag. Even your MSCs, your platelet products, even your ECM, we can store for you. Once we do it, it is for your 25, 30 years. You can reuse whenever you want for any other indications which is required for using this. This is a fact like. Then you can use the ASCs, that is stromal vascular factor, along with the micro fat molecules also for skin conditions, for what is a dermal loss or skin loss or fat loss. We can use it for the skin conditions. And this will help to improve the graft survival as well as new vessel formation. This particularly cell transplantation along with the ASC is indicated as a region tube module for blood vessels, nerve ends, and the epithelial cells. This comes to help even the flap. When you are raising the flap for the grafting, it improves the quality of the flap, make it scarless incision, scarless healing. Extracellular matrix, again, one kind of tissue present from your body, which is present as a typically it can be used in multiple domains. It is surrounding the cell, connecting to other tissues of the body. So this you can see, ground substance of the material of the skin, connecting each cell to other cells. They are present in the form of collagen fibers, elastin fibers, reticular fibers, extracellular matrix, which comes from these cells. And also there are a number of elastic, not only elastic, adhesion molecules are present, which are helpful for cell-to-cell connect, signaling pattern to maintain, so as the healing takes place without scar formation. If their ECM is not there, healing will go with the scar formation. So we support by giving your healing process for when there is a wound, when there's a scar, ECM, platelet, MSCs will heal your scar without any scar formation, whether it's a keloid, whether it's a hypertrophic scar, with a non-healing wound, with a diabetic wound, with the eczema, whether it is in lipodermatosis or any other disease chronicity of the skin, which you have got non-healing characters, and patient or you or doctor's patient becomes a gift for 100 years, 20 years, 30 years, not healing wound. And ultimately doctor gets fed up of, and patient also gets of this, applies steroids and spoil the skin. The entire process challenges and limitations. How we optimize our cellular therapies for skin is that, what is the ideal source for healing? What is the source which will heal easy my skin problems, infections, eczemas, healing wounds, diabetic wounds, scars, keloids? First one to understand this, we work on ideal source type and prepare the customize means precision. What is required for you? Angiogenicity required for you, neurogenicity required for, utilization required for, leukoderma healing, or melanocytes are required for you, or hair problems are required for you, depending on that. Route of delivery. How do we deliver those cells in the skin? That also is very important. Whether it will require a single or repetitive dose. Timing, early treatment, delayed treatment, dose-response relationship, how much dose is to be used, for full function, determinants of full cell function, how do we recover complete, and what are the endpoints we should consider for this novel, using novel diagnostic tools, and limitations of viability and retention, limitations of the cells, in which condition we should not use, what are the problems. And also we identify the responders. How do we optimize the cell-based therapy? This is a complete journey at STEMRx we follow for treating these conditions. And currently why I spoke to you all this is that we know there are conventional treatment modalities which are having a lot of limitations. Any kind of surgical intervention, very painful if you do skin. There is no response in chronicity. They become wounds, some time of chronic. Steroid use comes in, antibiotic use comes in, no satisfaction, healing will get into complications. Now, all this can be prevented by the technology of stem cells, growth factors, platelets, ECM, cytokines, cytokines, chemokines, bioactive molecules, exosomes, all those which are prepared in non-cellular molecules at our lab. Now, how do we heal and why we get scar or non-healing situations? We get a tissue injury, hemorrhage, clotting, then inflammatory infiltrate, cell death, fibroblast comes into picture to remove the migration of them. Then comes the post ECM deposit, which is the most important. I tell you, just now told you, ECM, which makes either a scar or a non-scar formation bearing proliferation of the cells. So we want to see the other part of ECM here. Now, we don't want to see the new host of ECM coming for cellular component, not the inflammatory part. And then ECM organization scar formation, tissue repair. Now, if the scars are formed, we go for the rehabilitation of the scar. And if you want to see the scarless healing, these steps which I showed you with the factors which are involved, late inflammation, proliferation, and remolding takes place over weeks and months together. The first 3-4 steps, if you want to change these steps from here, if you see, where inflammatory cells come in the picture, if we don't allow inflammatory cells to come in the picture and go towards the proliferation step of collagen fibroblasts, late inflammation, we can make the healing without the scar formation. Now, scarless healing. What are required for you? Inflammation, TGF-beta1, TIMP, ECM remolding, collagen 1, persist one, my fibroblast persist there, and leads to one matrix interaction for wound contraction. But if we go for scarless using the technology which I am doing it, then there's no inflammation. TGF-beta3 comes into, MMP comes into, collagen type 3 comes to, apoptosis reduces, and ECM comes to remodeling. Along with the factors, what we use at our center are IL-4, 8, 10, which are most anti-inflammatory healing cytokines. TGF-beta3, again a healing cytokine. Macrophage 2, macrophage 1 and 2. One is inflammatory, M2 is non-inflammatory. Fetal fibroblast and blastomeres are the thing which we add for your scarless healing. Globally, if you see, various cell components have been used for healing the wounds at different levels. At aging problems, psoriasis, lipodermatosis, aesthetic procedure, Romberg disease, microsomia, lipodermatrophy, mixed connective tissue disease. All these you see, various molecules have been used with combinations. And now these combinations are available at StemRx, and we definitely make you a beautiful benefit of healing all these conditions. These are global studies, and these are the studies which are going on at different levels. I'm giving you evidences with the scientific background. Again, some studies which I have shown you here, direct injection or indirect injection, or local application, delivery, how it to be done, cell-assisted lipotransfer, how it is done. All these references you can use for your reference also. And if you have any questions, you can always come back to from these references. It's a huge market. I don't have to talk about it, like $1 trillion market. And what we look in this healing process by the stem cell is quality of the skin, wrinkles or rhytid formation, volume of the skin, hair loss, scarring, and healing without scar. These are things which we look into chronicity or acute. What are the facts? I have spoken you. What are the fictions and what are the facts? Now, fact is that stem cell has got the Nobel Prize in 2012. Nobel Prize is for John Gordon and Shinya Manika for the discovery of reversing the biological age from adult stem cell, for adult skin fibroblast to embryonic potentials of the cell. This can be done by this, and so that the healings can be without scar formation. There are certain, we can talk of regulatory problems. Yes, there are, but autologous therapies, there are no regulatory issues because your guideline, because I was one of the members who has drafted the guidelines. Whereas these MSCs, when you use for yourself from your own body with a single process, then it is your process, minimal manipulation. When you use it without manipulating them, then it is your exemption from any kind of regulatory process. So we talk of autologous, homologous, minimal manipulation technologies. as an good news for you to use your skin problems. The fiction is that in the market, when you go, people talk we are using stem cells, but let me tell you, hardly there are very few scientists, doctors who know about the science of stem cells. What is true is the fiction is that people call platelets as stem cell therapy and use them. This is a bigger fiction. Let's not talk on that. Core competence at our StemRx is point of care services. We have point of care services in the form giving MSCs, in the form of SVF factor, in the form of growth factors, the platelet, in the form of ECM, in the form of ECM, plus in the form of exomes also. We also will design the protocols when you come to us, how you have to use these things for healing for the skin. Now, how much time it takes place for the process, which we'll do for you maximum 1 hour, not beyond that. And we have certain molecules which are called lyophilized platelets, which I showed you earlier one, which can come in a vial. We can just dilute with the normal saline with the growth factors and apply on the skin or inject in the skin for healing process of the non-healing wounds, diabetic ulcers, diabetic gangrene. Certain studies I'm showing you using this kind of POC, point of care product, particularly non-healing wound. I have shown you here non-healing wound, where 15 patient study was done. Critical limb ischia, 28 patients were studied here. So condition, dermatology, cosmetic, we are not going to talk. Contouring, we are not going to talk. Augmentation, flare, scar, various skin conditions, other applications, scar, keloid, all these two, flaccid, which I already spoke to you just now. Now, the overall application, as I told you, future of dermatology. Now here, this is a amniotic band syndrome, where by birth, there are scars and strictures on the skin at the finger, and which patient gets an abnormality of the fingers and legs after the birth. These are because the amniotic bands in the uterus. We have wonderful treatment for this skin problem. And this is a baby which was treated. You can see before and after the bands are gone and the scars are gone. Now, this is an article published by us showing this Zambian girl by using stem cell technology. Her skin problem of amniotic band syndrome was completely cured. So everything I have got as an evidence with research publications. This acne, this is a type 1 diabetes girl having severe acne on the face. She was from Muscat. After the treatment, her type 1 diabetes also went off. You can see the face. The girl has become young, charming girl, teenager girl. You can imagine what kind of mental depression the girl should be going from her lip pigmentation to entire cheeks and nose and forehead. Now the girl has become beautiful using stem cell technology. So I have got a lot of paper publications. This atopic acne scar, this is a publication done in a Journal of Cosmetic and Trichology. Before and after, if you see this girl, you can see the scar, you can see the pimples, lost skin texture, oily face, and now you can see glorious face. This took place for me only maximum 3 months to transform from this phase to this phase. Don't you think it's a changing game, changing this technology? No, any kind of surgical or steroid preparation can do these miracles. Again, published research paper on this girl. This is a published paper, research was published again. Before and after thin hairs, we can make it to thick hairs before and after. So we have even, you can use here, we have got 2-3 technologies. Not only lyophilized platelets and MSCs or any kind of micromolecules, but we have a beautiful technology developed for the hair is that follicular stem cell engraftment. Follicular stem cell engraftment, but done by only local injections along with PRP growth factors and MSCs, so that these hair follicular growth factor, which are isolated from your own hairs in the lab, prepared a solution or a cocktail using MSC in it and PRP growth factors, and then you transplant them on the scalp. You will see improvement in the vascularity, you will see the viability, you will reduce the apoptosis, you will get the change in hormonal or immune structure of the hair follicle will change in case of alopecia areata as well as regular because of hormonal loss. Or acute conditions I told you. We have used, you can see the bone 75-80%, and you can see in 15 days using these compositions along with the collagen prepared from the ECM of the patient or from the swine bladder and composition using platelet, you can see the wound seal up without scar formation. As I told you, acute conditions. You can see now after 30 days, you cannot see this man had the bone same condition within 1 month time. For which we have used a spray gun using the growth factors MSC to spray on the wounds so that the simple, without using any antibiotic, without using any painkillers, without using anything, because these molecules itself will release pain controlling molecules. They also use immunomodulatory molecules. They also bring healing, angiogenesis, also vasculogenesis, and epithelialization. Elephantiasis. There's no treatment in the world. Trust me, no treatment. Ultimately, patient either does a suicide or becomes a bedridden because of huge leg elephantiasis and discoloration and disfigurement of the leg. Using the technology which I spoke, you can see that in 1 month, the entire lymphoangiogenesis starts. Epithelialization changes, scar formation goes away, keloid formation goes away, and normal skin develops, and the lymphatic flow starts back to the normal. Again, lipodermatosclerosis. This lady had gone to every dermatologist, every cosmetologist, and the best of plastic surgeons in Bombay. When she was to the stage where she wanted to amputate the leg because of the smell which was coming from the secretions of lymphatic flows. After 1 month, you can see the leg. The entire inflammation is gone, wounds are healing up, discoloration is going on, completely going off. Today, after 6 years, she enjoys with the normal. She still comes to me for some other problems. This article, her name is Lalita, which is also article published recently. Diabetic wound, non-healing wounds, before and after. This man was 6 months suffering with this, and now it's healed up completely. You can see diabetic foot ulcers. If somebody would have amputated the foot. Here, we have saved the complete foot, even the middle finger, which was third finger, third toe, which would have been amputated otherwise, we have saved it complete as it is. Foot ulcer of diabetes, first week, second week, 4 week, completely healed up. Finger regeneration. The life of the primates, particularly primates means the small animals, like you can say starfish, zebrafish, they can regenerate the parts of the body. Why? Well, I'll take a separate webinar on this to explain you. And this we can do in human being. If your finger is cut, we can regenerate the finger completely using ECMs and MSCs. ECMs are extracellular matrix and blastomeres, which I showed you in the first slide, what we use in blastomeres. And these will give the signals to the skin, nail bed, bone component, vascular component, and skin component to regenerate the way I showed you in the primitive animals. So we have followed what happens there, we are trying to bring it in the adult also by passing certain steps of healing, inflammatory healing, and getting blastomeres and IL-10 at a place along with ECM. So you can regenerate the fingertips also. This is something which I'll take some other time. How do we regenerate the parts in our lab? How do we make the dressing material from the placental sheets or ECM of the body? We can, in your clinical practice, or you can mix and match with the laser in the future along with the stem cells, so as you will get a best result using erbium YAG lasers, CO2 lasers at what micron length, and you add to it stem cells or growth factor, your regeneration will be much, much better. Low light lasers for skin region. Along with this also, we want metalloproteinases more. We require upregulation instead of inflammatory molecules to get the scarless healing or wounds. Bring the vascular components, remove the atrophic components. You use both the component mixing one, and then you'll get the beautiful lack of hearing, wound hearing, everything. I have even treated in patients, some of them had an infection of the wounds, particularly ear sinuses where that I forgot to keep the photo here, where she was sent to every antibiotic. She was scared to take the antibiotic. I use only the platelet growth factor and MSCs just to inject regularly. And within 3 to 4 weeks, her fistula closed completely without antibiotic. So my dear friends, there are certain references for you. Those who are interested, they can always connect me with the references to see whether there's a hope or heaven. It's a big haven for you. It's not just a hype. These are the research papers published by me. Various paper lifelike platelet advantage application in COVID and 19 patient or skin disease lifelike platelet, various disease conditions. There are various publications for platelet growth factors, which we are our primary. This is my entire team which supports me in my lab to develop my products as well as science. I'm really, I'm obliged to them to make these wonders happen at STEMRx. And I want to extend this facility to all the community, all the practitioner people who wants to learn these and improve their quality of practice, outcome of viewers, and the patients who want to get relief from the chronic skin disorders, acute skin disorders. Whether it is in hair loss, whether it's a leukoderma, whether it's eczema, with the lipodermatoses, whether it is some kind of, you can say, vascular disorders, autoimmune related, or psoriasis, or scleroderma, you talk of the conditions, we can deal with them. So dear friend, life is beyond hope. We consistently try towards the future. We find technology and scientific breakthroughs moving us towards the direction what was never imagined. Ongoing discoveries of stem cell and alternative techniques of medicine control our life. Stem cell therapy and growth factors and ECMs have gifted the life in biological science today. Advances in this science has managed our wellness to our fuller and healthier lives with a new hope. So, dear friend, you can fulfill you living your lives with big dreams, enable us to live big dreams. Thank you. These are my numbers of my team and emails. Those who are interested, they can communicate with me. Those who want to have solutions, they want to learn some kind of technologies, the doctors who want to participate in the training program, they can always call them, fix up the timing when they want to come. We have certificate programs, we have training programs, plus those patients who want to get rid of their chronicity, they can connect to my team. And today they want to ask some questions, they are welcome to ask their questions to me. Thank you for your patient hearing.